Sjögren's syndrome is the topic for this presentation, and Sjögren's syndrome is an autoimmune disorder, and it's believed that what's happening is, in response to an infection with a virus, the normal cells that are responsible for helping us fight an infection actually attack our own moisture secreting glands. So which moisture secreting glands are we talking about? Well, you'll definitely have to remember the two most common, and those are the salivary and lacrimal. Okay, so if the moisture secreting glands, these two in particular, are attacked through an autoimmune disorder known as Sjögren's, what are the symptoms? Well, salivary glands produce moisture in the mouth, and lacrimal glands are involved in producing tears. So if those two things are not happening, if those two glands are not secreting the tears and the saliva, you get dry eyes and dry mouth. So if there's anything you need to remember for Sjögren's, it's dry eyes and dry mouth. Okay, so why does this happen? Well, as I said, it's autoimmune. It's basically the body is attacking its own glands instead of fighting an infection. And it's mostly 70% of the cases are primary, meaning there's no other associated condition, but 30% of cases are secondary. And what that really just means is that Sjögren's is occurring in association with some other autoimmune disorder, and most commonly those are rheumatoid arthritis, lupus, and there's several others, but these are the most common ones that Sjögren's syndrome can co-occur with, coexist with. And instead of writing it out all the time, I'll just refer to Sjögren's syndrome as SS. Okay, so what are the symptoms of this? Well, as I mentioned, there's dry eyes, which is known as xerophthalmia, and then dry mouth, which is known as xerostomia. Those are the two main symptoms. But because it's an autoimmune disorder and it's systemic, it can go and attack other parts of the body as well, quite a few parts, and I'll just list the most common one other than the eyes and the mouth, and that is the joints. So you also get arthralgias and arthritis. So you have inflammation of the joints and also pain in the joints. So how do you diagnose this? The diagnosis is actually, there's about 5 things that can be done. Not all 5 things are always done, but I just wanted to go through all of them. Well, the first 2 are simply just symptomatology, reports of symptomatology. So you have eye symptoms and you have oral symptoms, and they usually just use a estimate of greater than 3 months of chronic dry eyes. But of course, that by itself doesn't mean you have Sjögren's, but it's part of the diagnostic workup. Oral symptoms, same kind of thing, greater than 3 months of dry mouth will help lead toward a diagnosis. And now we get to this more specific testing, and there's a test called Schirmer, Schirmer's, Schirmer's test. What that test does is it measures the quantity of tears secreted in 5 minutes onto a piece of paper, and in a person with SS, they will produce less than 5 millimeters of tears on the paper strip. Normal person will obviously produce 15 millimeters normally. So it's a test that measures the quantity of tears secreted, and person with Sjögren's always has the eye dryness, so they secrete less tears. The fourth one is an important one. It's measuring autoantibodies. Autoantibodies. Autoantibodies are actually very important because they're always on the exams. Now they'll give you these, and I'll write them out for you. Ribonucleoprotein Rho and La. Now the Rho and La is probably the harder ones to remember because their secondary names are very easy because they have SS in them. SSA and SSB. Well, SSA and SSB are easy to remember because SS is Sjögren syndrome. But the Rho and the La are just one of those unfortunate things you just have to memorize. And these are the autoantibodies. In Sjögren syndrome, and I have to make this clear, they will test antibodies to these ribonucleoproteins. So let me write that out. In Sjögren syndrome, they will test. Let me make sure you clearly understand. In Sjögren syndrome, they will test antibodies to ribonucleoprotein Rho and ribonucleoprotein La. And then the final thing, I can just erase it all. The final thing, which is sometimes done and always done, is a biopsy. A biopsy of what? Biopsy of any of the glands that are affected, usually the mucosal glands and salivary gland biopsy. We'll just write that in here, salivary gland. And that's done to look at the histopathology under a microscope to check. One more thing I wanted to point out is a physical exam diagnostic characteristic, physical exam finding, is that is parotid gland enlargement. And that's something that can be checked very easily on physical exam. And here's a picture of somebody with Sjögren syndrome, and you can clearly tell their parotid gland is very, very much enlarged. So that's something I wanted to mention. All right, so now we've come down to the treatment. Well, the treatment, there's basic. I kind of break this up into basic and more serious management. Basic management of Sjögren really is just topical eye drops, and you can get these at any pharmacy. They're known as artificial tears. Artificial tears. They're really just over-the-counter lubricating eye drops, really, and they are used in the management of this. There's also what you do is you educate the patient to avoid medications that can cause dry eyes and dry mouth, and those include antihistamines and anticholinergic drugs. Avoid these. And now the more aggressive treatment for more serious cases involves three categories of drugs. The first is steroids, such as prednisone. The next one is cyclophosphamide, and finally hydroxychloroquine. Some of the more aggressive or serious cases of Sjögren's can involve treatment with one of these. And finally, I'd like to finish off with a couple vignettes. And here we go. A patient with rheumatoid arthritis mentions to her physician that after many years without dental problems, she has recently had 7 dental cavities filled. This finding suggests that she should be evaluated for which of the following diseases. This is a good question because it's not very obvious. If you remember, in 30% of cases of Sjögren syndrome, it coexists with another autoimmune disorder. Well, they've already mentioned to you which autoimmune disorder the patient has, and she has rheumatoid arthritis. Now, that by itself is not going to lead you to Sjögren's. But one thing that they do mention is the dental caries. Now, people with chronic dry mouth can eventually get dental caries, because chronic dry mouth can lead to oral problems, which include infection with candida. It can lead to tooth decay, and you can also get stones in the salivary ducts. But this tooth decay, which is really what this vignette is talking about, hopefully can point you in the right direction, that this patient is most likely develop Sjögren syndrome, and fortunately they've listed that as one of the answers. And the final vignette is this one. A woman with swelling of the oral mucosa and dry mouth is found to have intense destructive inflammation of the salivary glands and antibodies against the ribonucleoprotein LA. Which of the following clinical findings would most likely be associated with the syndrome? Well, like I said, there is LA again. Ribonucleoprotein LA is also known as SSB, but they're not going to put SSB because it's too easy. And if you remember, these are involved in the diagnosis of Sjögren's. But they don't talk about Sjögren's in the answer choices. They ask you, which of the following clinical findings? Well, I look through here. Well, what are the two basic things of Sjögren's? There's dry eyes and dry mouth, right? And dry eyes, the medical term is xerophthalmia, and dry mouth is xerostomia. Well, xerophthalmia is listed as choice A.